Found out that Kyra, like myself, we both get this a lot, or we don't get this at all, rather. We're both Ukrainian, okay, which isn't something that I ever hear, and definitely not something that she hears.
Boiled eggs, boiled chicken.
Oh, boiled chicken! Oh my God, you are Ukrainian. Okay. You're way more Ukrainian than Jamaican. Like that's. I've done this like maybe 5 times before. You're fine.
Wait.
Fingers curled. Keep them strong. Oh, nice nails. Okay.
Thanks.
Crush it. Are they real?
Yeah.
Oh my God. Very impressive. So am I.
you.
Yeah. That's good. Kyra. Good to see you again. So Kyra and I met at a networking group. How many months ago was that? Like 6?
I think it was about
6 months ago. This past summer, we're shooting this in November, and she is both a personal trainer as well as a realtor. So what we've got is somebody who's very, very active in their free time, which is great. It's good that you're like that, but also has the very stressful job of being a realtor. Okay, because that is. We were actually just talking about the market before we started shooting this. It's not great, but those two things, when combined, can sometimes result in injury. So what's going on with Kyra right now, I'm going to let her kind of take us through it, but I think you mentioned you have some lower back discomfort, some trap stuff, headaches. Why don't you kind of share with us what's going on?
Yeah, so some pretty severe low back pain, mostly when I train lower body at the gym. Could have something to do with the pressure when I'm back squatting or etc. Right trap is pretty elevated, I've noticed. And I do get headaches, but I don't know what the cause is.
Causing
I've had 3 concussions in the past. I don't know if...
How long ago were those concussions?
Oh, probably 7 years ago?
7 years was the most recent one?
Yeah.
Okay, and to ask, those concussions, they were kind of spread out, right? They weren't like one after the other?
They were one after the other.
Oh, sick. Okay, so that's good. So how far between each of them?
About between 6 months to a year. So they're
okay, so that's, I still consider that spread out.
Okay.
When I'm asking somebody if they've had them back to back to back, I'm asking specifically like if you've gotten like a concussion on top of a concussion, or if you've had time to at least heal between them all, right? For more information about concussion on concussion, Google Rowan's Law, R-O-W-A-N. In Ontario, it's a law, all right? If you do get a concussion, you're playing sport or you're doing some sort of activity, you should immediately stop for the day and go get examined because you don't want to get a second one. So that's why I was asking there, but it's good that it seems that you probably did that.
Yeah.
Okay, good. Yeah, we're in Ontario, so it makes sense that she'd do that. Yeah. All right, so this lower back discomfort, how long has that been going on for?
I would say 5 years.
5 years, so a while. Was there an initial onset incident where you did a movement and it just came on, or it's crept up?
It's over time.
It's crept up.
Yeah.
Okay.
Yeah.
You mentioned some lower body exercises typically aggravate it. What are those exercises?
Usually back squats on the barbell.
Do you find front squats to be better, or do you do front squats?
So they're better. I just don't really have the mobility.
I don't have the mobility in the shoulders either. But the fact that having that weight on your front is better for the low back is interesting to me.
Yeah.
Okay, keep going.
Sometimes Bulgarian split squats. Sometimes deadlifting.
Okay.
Not usually. But that can also aggravate it.
Okay.
Usually it's squatting.
Usually it's the squatting is the most for you. All right. And this upper trap region, when was the first time you kind of noticed that asymmetry there on the sides?
I would say a couple months ago.
Okay.
Pretty recently.
Were you I guess you just noticed it in the mirror or something?
Yeah, I was working out and I'm like, oh, this is weird.
Much elevated.
Yeah.
Are you right or left-handed?
I'm right-handed.
You're right-handed.
Yeah.
Okay.
Yeah.
People very often are asymmetrical, okay? A lot of people will worry about one trap being higher than the other, and it can be normal. It can also be indicative or suggestive of something else going on, so it's good that you get it checked out to determine if it's one of those things. The lower back pain, is it on both sides, or is it on the right or left side?
It's usually on one side or the other.
So it switches.
Yeah,
okay.
I can't recall exactly.
Which side is more dominantly hurt, I guess. Okay, you don't
sometimes middle, sometimes
that's okay.
One side or
now with both, I guess, the lower back as well as kind of the upper trap region complaint, are you getting any kind of what we refer to as radicular symptoms? Pain or numbness or tingling going down the back of either the legs or the arms? Yeah, you are. Okay, so tell me about that a little bit.
Usually it's the further I go into a training session for myself. I can either stop right away or I'll continue. When I continue, it usually is numbness down the back of my leg.
Okay, how far? Does it go down to the knee? Does it stay within the glute? Does it go down to the foot?
I would say probably to my almost my knee.
Almost the knee. Okay, so really in that like hamstring portion, right?
Yeah,
so I'm curious as to whether or not that's like a true numbness, tingling, neurological thing, or if that has more to do with just the muscle fatiguing out, right? Like, I mean, the hamstring, of course, does terminate at the knee, and nerves would continue to go down lower, the femoral nerve. But we can figure that out with our neurological exam there, okay? Now, when you do get that numbness and tingling, is it numbness and tingling or is it pain?
It's very painful.
Okay, it's
but
painful.
It's also numb. I don't know if that's possible.
Combination of both?
Yeah,
okay,
I would say
combination of both. It's also possible we're affecting both of the structures, right? It's very easy to fall into these pigeonholes of like, oh, this is the one thing that's wrong with you. This is the silver bullet. We're human, okay? We can have multiple things going on at once. So anyways, we'll check for all of that. Okay, so we got lower back, we got trap. Unknown headaches. Have you noticed any kind of pattern with the headaches at all? Do they come on with the kind of crappy weather we've been having lately?
Probably the weather.
It's very gray out now, guys. So maybe the weather might have something to do with it. With the trap being elevated and neck structure is also being a very common source of headaches, we're going to screen the neck as well up in this region. And then we're going to treat you. Okay. Do you have kind of any questions or comments about what we're going to be doing today? No? Perfect. All right, then we'll get right into it.
Perfect.
So to recap, Kyra is having an elevated right trap, which is this side. Some lower back pain on the side that she's not really able to distinguish on because it jumps around. And headaches alongside some pain down the... Which leg did you say that was? Or was it both?
It was both.
Both legs.
Yeah,
okay, just to further compound the issue. So, first thing we're going to do is we're going to do our range of motion exam. We always do that. Let's start with the neck, work our way down. So, I'm going to get you to start by rotating as far as you can to the right, please. Just your head.
To the right?
Yeah, to the right. Perfect. So, that's as far as we can go. So, we got about 65 degrees that way. Let's get you going to the left as far as you can. So we got a full 90. So this is interesting to see that we actually have more range of motion looking to the left as compared to the right. Very interesting to see. Was that uncomfortable at all looking those directions? Were you getting a pinching through the neck or kind of the upper back? Where were you feeling that?
So this way it was like...
When you were pulling to the left, you're getting like a pulling back in the upper right suboccipital region, which is the top of your neck. Okay. Maybe you should bring your chin down to your chest for me, please. Does that cause any discomfort or pulling back here?
No.
No? Okay, now what if I do something kind of mean, push it further?
Yes.
Yes? Okay. I'm going to get you to look up towards the ceiling for me, please. Is that okay? Now again, if I do something kind of mean, still okay?
Yeah, it's okay.
Perfect. I'm going to get you to look face forward. Tilt your right ear to your right shoulder, please. We get to about 50 degrees. Now left to left. About 50 degrees. So that's equal. So the only thing that I'm really seeing with that is we get some pulling sensation when we go into the passive range of motion of flexion or bending your head forward, and a reduction in rotation to the right side. She's able to again get 90 on the left and limited to about 65 on the right. Okay, I'll get you to give yourself a tight hug for me. Tight hug. Rotate your whole back towards the left as far as you can, okay? So here we get to about, call that 40. Now rotate as far as you can to the right. Okay, we can get a lot further to the right side. Are you noticing that?
Yeah.
Yeah, so here we get to like 60, okay? So we get a lot less rotation to that left side as compared to the right. You can relax here now. Is that because we have more muscle tension on the right side here? It's kind of limiting her moving away from that direction? Who knows? But still, it's interesting to see. Next, I'm going to get you to stand up for me, please. And now we're going to get you to do a lumbar range of motion. So from this position, we're going to get you to just bend forward, try to touch your toes for me.
Okay.
Does that provoke any of the discomfort in the low back at all?
No.
No? Okay. Now come back up. And now I'm going to get you to extend backwards, which is going the other way. Does that provoke any of the discomfort in the low back there?
It is tight.
It's tight.
Like
so
right
where
here,
do you feel that?
Like
She's pointing right to her sacral base. Okay, she's pointing right. You can have a seat for me. Right to where the sacrum, which is the bottom of the spine, connects into the iliums, creating the sacroiliac joint complex, as well as connecting into the L5 or the bottom of our lumbar. So very, very common site of tension in people. So that's a good range of motion exam. We're going to do a neuro next. Okay. All right, so Kyra's already in the right position here. We're going to be doing motor testing as well as deep tendon reflexes of the upper limb. Why? Because we're probably going to be treating the upper back and the C-spine. So going to keep arms right there. Don't let me push you down, okay? Good, nice and strong. And good, nice and strong. Going to get you to bring the arms forward. Curl the wrists backward for me, please. Yep, crushed it. Keep it strong. Keep it strong. Good. Turn over. Curl the wrists inward, please. Nice. Nice and strong. Nice and strong. Fingers curled. Keep them strong. Oh, nice nails.
Okay. Thanks.
Yeah.
Please don't break them.
I'm trying specifically to actually avoid, I don't know if you can see it on the camera, but I did not touch the nails there. I know how much effort girls put into their nails. You got to make sure that you're delicate of those, okay? So well done. You need you to turn over, keep the fingers straight, and please gently squeeze my fingers. Yes. Okay. Crush it. Are they real?
Yep.
Oh my, okay, that makes sense. Oh my god. Okay, very, very impressive. So am I. Yeah, that's okay. Let's do the deep tendon reflexes now. Okay, so I'm gonna go ahead and turn the arm over. You're gonna relax right there. There we go. There's a finger twitch. There's another twitch, and I'm gonna get you to drop the arm into my hand. Give me the full weight of your arm. Good. A lot of people have trouble with that one, but you crushed it. Good job.
Thanks.
All right, and yeah, okay, I'll come around the back for the other one. You just hold right there. Good. 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 And drop the arm for me. There we go. Awesome. So that is a normal upper limb neurological exam.
Okay.
Good job.
Thanks.
Let's find the tendon there. There we go. Good. And tendon there. Oh, a little too high. There we go. Perfect. You can relax the foot. There we go. Good. People hate this one. That's all good. Push the leg up into my hand. Good. Lift the toe up into my hand. Push the leg up into my hand. Lift the toe up into my hand. Good stuff. So that's a normal deep tendon reflex as well as motor testing strength of the lower limb. Sensory would require us to get directly at the skin, so we're probably not going to do that one on camera. But all the same, that's a normal right now lower limb exam. So Kyra is dealing with some lumbar pain. She's not sure which side it really originates from, and she comments that it's right at the base of that sacrum. So basically we're going to screen both sides. Okay. So first thing we're going to do, I think I do it in pretty much every video, is a straight leg raise. I'm going to take this leg and I'm just going to lift it straight up as far as it's going to go. Okay. Now, do you get any lower back pain with this? No. Do you get anything pulling down the leg at all?
No.
Or no? Okay. So we can get to a full 90 there. Very impressive. Most people can't do that. I'm going to get you to slowly lower this leg down now yourself. Slowly lower it down. Any discomfort with that in the back?
In my hips.
In your hips a little bit. Okay, where on the hips? On the front, the side, or the back?
The front, it feels like it's going to pop out if I don't.
Is it going to pop out if you don't what now?
If I lower it slowly, it feels like...
It feels uncomfortable in that region. Okay.
Yeah.
So when we are slowly lowering that leg, we're doing two things. Number one, we're eccentrically loading the hip flexors, okay, or the psoas muscle in this case. The psoas can be a source of lower back pain. So that's kind of interesting to hear. But you're feeling that pain in the hip, right? Not in the low back.
No.
Okay. So you're getting low back pain, but you felt that in the psoas. So I'm going to file that away for a moment. We'll do Thomas test later to see if we do have psoas involvement, which is also really common in active individuals for some reason, which is weird because it's our sitting muscle. I don't know how that works, but you're a realtor. You drive. That's it. You drive a lot. Okay.
I do.
I'm going to bring this up as far as it can go. There's a lot less resistance on this side. It actually feels a lot easier to get you up to 90 versus the other one. Any low back or hip or like pain down the back of the leg with this one?
There's like
a little bit of pulling.
Yeah.
Okay, but it's nothing. So the pulling in the hamstrings is normal once we hit 90 degrees for people, so not too worried about that. And you should just slowly lower this leg down yourself now. Anything in the back, do you get that hip sensation?
Yeah.
You get the hip sensation or the back?
The hip.
The hip, okay, so same kind of concept. I'm going to get you to actually slide down the table so your butt is like right here for me, okay? Just come all the way down for me.
Like,
and then and then get you to lay back once again, please. So, and just drop the legs for me if you can. Perfect.
Okay.
Now I'm going to get you to pull let's start with this leg. I'm going to get you to pull that knee into your chest for me. You can use your arms, okay? Pull, 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 pull. And then slowly lower it down. Okay, and then one more time. Pull, 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 pull. Okay, so I think, you know what I'm going to do is I'm going to actually do this one on camera. So stay right where you are.
Okay.
I'm going to get you to relax both legs for me again, okay? All right, so I want you to pull that left knee one more time. And guys, I want you to watch her leg here. The hip actually comes up. It elevates when we pull that other knee into the chest. Okay, now what that tells us is that psoas muscle, which exists off her lumbar spine, comes into the front of the hip area and connects almost into the groin right around there. That is probably going to be hypertonic with this positive Thomas test. You can relax that. Let's do it the other way. I'm going to get you to pull this knee into your chest now. And let's see if we get the same. Oh yeah, we get even worse on this side. Okay, so we saw this elevate as she pulled that other knee in. So that tells me there's definitely psoas involvement, which could be what's causing pain in their lumbar region. Okay, Kyra, I'm going to get you to lay face down for me next.
Okay.
So Kyra was actually keeping a bit of a secret from me just now. We just did the Thomas test, okay, and that made me suspicious of psoas involvement for her lower back pain. I kind of just walked you through the anatomy of the psoas where it is. I'll put a picture of it on one of these sides. I don't know which side, whichever one's better, Sarah, so that you guys can see. But the psoas, it connects off the lumbar spine down into the groin region. She just said that, like, with the physiotherapist she's been to before, did you say massage too, or?
Just physio.
Just physio. Yeah. They were very much pointing at the psoas as like a source of this discomfort. She didn't tell me that before, but it's reassuring to see multiple practitioners, multiple experts, all kind of hone in on the same thing. Okay, that tells you that, well, A, they're being honest, and B, they're probably correct if they're all pointing that direction. Yeah. Anyways, let's feel the psoas now. So for this, I'm going to get you to bend this knee for me. Good. Now I'm going to take my hands, I'm going to find that ASIS, that bony part of the pelvis right there on people, right? I'm going to take this, I'm going to get you to just turn your head to look at the window there. You need to take a big breath in for me, and all the way out. And one more in, all the way out. Okay, yeah, so we got wincing on the face there, and you guys can see that. I'm going to get you to slowly lift this leg like 5 inches straight up off the table for me, if you're able to.
Kind of.
A little higher, a little higher, a little higher. Nice, now slowly lower down. We're going to do that 9 more times, 10 reps, okay? Oh my, try not to laugh, because A, it's going to hurt, and B, it's going to buck me right off because it engages your abs, okay? So, Kyra is very strong, in case anybody was wondering. Keep going, good. I think that's 5. I'm bad at counting.
Yeah.
Good. Patients are great at counting when it comes to doing this one. They never muck it up. 8, 9, 10. Great job. So how terrible did that feel?
It's pretty bad.
It's pretty bad. Okay.
Yeah.
Great news. We're doing it 2 more times on the same spot. Okay. And one of the spots is usually more painful than that one.
Okay.
So let's start by going higher. So again, I'm going to find that boniness, but I'm going to go up by maybe like 2-3 inches because it's a long muscle. So I want to try to get more into the muscle belly of it. Then we'll get into the tendon closer to the groin afterwards. So let's get higher up. Big breath in for me. All the way out. And in. All the way out. Go ahead. Not as bad?
Not as bad.
Okay, good. So this one's usually the easier one, so I'm happy to hear that. I lost count.
We're at 9.
Oh, perfect. Okay, I'm glad you're paying attention. That's good. All right, now we're going to get down more into that tendinous insertion. So we're going to find that boniness. We're going to creep down about 2-3 inches. And of course, we're going to be careful because this is a more sensitive area on both men and women. But I'm going to get you to take a big breath in for me, and all the way out. And once again, in, all the way out. And now go ahead, 10. This is probably the worst one, yeah? Okay, yeah, this is most commonly the worst one on people. A little higher, okay? 6, there we go. 8, 9, and 10. Great stuff. Okay. Bad news, we have 2 sides.
That's
okay,
brutal.
so that means we're going to be doing it. I said, that's awful. That's terrible. Oh my god.
You know, I thought you were joking when you said the 10 reps. That's why I laughed. I was like, obviously.
No, I'm dead honest right now. This is a better angle for you guys to see exactly where I am putting my hands here. So we're going to find that boniness, which is right there on her. And I'm going to take a contact again. Get you to turn your head just to face there. Big breath in for me. Oh, we're going to bend this knee. My bad. Yeah, perfect. Big breath in for me. All the way out. And in. All the way out. All right, good. And 10 lifts. You are tough and you are strong. Okay, there you go. 2. Very nice and slow. Pretend like you don't hate this. 7, 8, 9, 10. Good stuff. Okay, now we're going to go a little bit higher. So again, finding that boniness right there. I'm actually just going to roll this up a bit, okay, if that's okay. Just flip like that. Perfect. I'm going to come up higher just through this region. Big breath in. All the way out. And in. All the way out. And 10. Go ahead. Good. Okay, now lastly we're going to do the tendinous insertion. So again, find that boniness, come down by maybe about just 1 or 2 inches, snake medial just a smidge, and you can see my hands are right there. Okay, so you can take a big breath in, all the way out, and in, all the way out. All right, and go ahead, 10. Yeah, you can't see her expression, but she's fighting this. This does not feel great. 8, 9, and 10. Great job, Kyra. You did very, very well. I know that's not the most comfortable thing. Now let's get you face down. All right, so Kyra, my hands are going to be going on your back now. Okay, if for whatever reason you want my hands to come off, the word is stop. Okay, you say stop, my hands come right off. Otherwise, I'm going to ignore any oohs, ahs, or ows that you may or may not say. Okay? So once again, Kyra's discomfort is focal to mostly the base of the sacrum, this region here, okay, connecting into the lumbar spine, so raging upward, and maybe a little bit through the SI joints, okay? So is most of your discomfort right here, you'd say?
Yeah.
Yeah? Okay. So again, that's more connecting into the spine. Let's go ahead and check the SI joints regardless, because we're here. So again, base of the spine is the sacrum. The ilium is the medical term for our pelvic bones. So, or well, part of our pelvic bone. So I'm going to press in there. Do you get any discomfort when I press through there or no?
A little bit.
A little bit? Okay. Now what about if I do it on this side? Any discomfort there?
Yeah.
Yeah, so worse on the right side, eh?
I feel it like here.
You feel it pulling on the left side when I press on the right. Okay.
Yeah.
So now we're going to climb up the chain here, working through the QL muscles. How is that? Is that kind of tender as I work up through there?
I feel that pain, I guess, like right in
You feel it pulling down below.
Yeah.
Okay. So a pulling sensation is very, very common in these kind of clinics. And what I've found is that pulling sensations, if you feel like pressure here pulls from up here, pulls from down here, is likely due to a fascial complaint, okay? So fascia, you guys are very familiar with it on this channel. That's what I use the tools for that causes that redness, that petechiae. We're definitely gonna be doing that on her lower back today. I already had it in mind for doing it for her upper back and her trap because we had that asymmetry she mentioned, but at this point we're just gonna do full spine, all right? Might as well be comprehensive, give her all the things. So we're gonna keep climbing upward and I'll show you what I mean in a minute, okay? I haven't shown her quite yet. So working through the upper back, like, is that at all tender to you? Because that to me feels like a rope.
Not really.
Not really? You're okay?
Yeah,
okay.
I'm good.
Maybe I'm making it up. I don't think I am, but how's that right there?
A little tender?
A little tender?
Yeah.
Okay. So we'll adjust the upper back while we're in through here. So you've never been adjusted before, right?
No.
This is usually the best one to start with, just because it's the most simple. So what I need from you, Kyra, in order to get this to go, is I'm going to get you to take a big breath in, and you're going to exhale all the way out, all the way out. Get the air out of those lungs. I'm really, really glad we have you in today. That was a great. How did that feel? Did that hurt?
Not
No,
really.
it didn't hurt. Okay,
No.
what did it feel like? Just kind of weird. You probably
It was weird,
never had anything like it, right? Okay. So let's go a little bit lower down. Breath in. All the way out once again. Okay, we might have gotten them all already, actually, because that was a huge one. But let's go one more, a little higher up. Breath in. All the way out. Yeah, okay. Wow, well, I'm glad we got that on camera. I'm going to turn the head here. Nope. Yeah, we got them all with one. Wow. Okay, so that was crunchy. Good. So now we're going to do the lower back. Then we're going to get into the neck and trap region, and then get into our massage work. All right. So we're just going to get Kyra in the right position here. I'm going to pull your shoulder there. You can hold the elbow. I'm going to bring this leg up. I'm going to scooch your hips towards the edge here. Okay. Come closer. I promise you won't fall. Now, did you feel that pop already? Because I just felt something pop as I was moving you. Okay. So this is probably going to be as crunchy as the upper back. Let's see. I'm going to get you to take another big breath in for me. And all the way out. Sink, sink, sink into the table. Good. Okay, so that one. There was just one. It wasn't as loud, but I think the mic would have picked that one up. Let's get you on the other side. All right, so I'm going to take this. I'm going to pull you off the shoulder. Hold it right there. Bottom leg straight. Perfect. Top one bent. Scooch the hips a little bit closer. Thank you. All right, so breath in. And all the way out. Good, good, good. Relax. So that was a much chunkier one on that side. That one probably felt better than the other side, would be my guess. Okay, good job. Good releases all around. We like that. I'll get you laying on your back now. All right, so Kyra has been dealing with that elevated right trap and actually feeling through her trap there. She's already wincing. Okay, like all I'm doing is literally, I'll just move this a little bit, is pushing into that muscle like that, and we're getting an expression, okay? So let's go ahead and compare that to the other side. If I press in there, nowhere near as bad, and I'm probably pressing a lot harder on this side too, and still nothing, okay? So if she carries her stress, it's on the right side, all right? That's what I'm saying here. So headaches, which is something that she's been dealing with for a while, she's not sure where she's getting them from. They can be caused by so many different things. There's literally like 100 different forms of headaches in the International Classification of Headaches database. We can get them related to pressure of the weather. We can get them related to stress. We can get them related to our cervicogenic or C-spine structures, which is what I work on. So let's go ahead and feel through the neck and the traps. The fact that her traps are that sensitive on the right side tells me that they're probably playing some kind of role. So I'm going to go ahead, pick that head up, and I'm going to start just by poking through the neck. Okay, so now we're at maybe, again, you can see my fingers in the neck region, and we're very sensitive on the right side. Let's press on the left side significantly harder. Is that, like, better, worse, the same?
There's, like, pain, like,
on both sides.
Up here.
You're getting it shooting into the head.
Yeah.
Isn't that interesting, guys? All right, so C-spine or cervicogenic headaches can be screened for by literally palpating or feeling through the neck intentionally and seeing if you get referral up into like the scalp region. Okay, so if you're getting that referral, that tells me that your headaches are something that I can help with, or something that any chiro or somebody who works on the neck can help with. Okay, so there's the good news there. Sorry you're dealing with it, but there's something we can do about it, right? Oh, did you feel that?
I did.
So, her neck really wants to go. I'm actually just going to do it, and then we'll do the soft tissue work then, so that we get some of it. So, are you nervous about having your neck done today?
Yeah.
Yeah? Okay, what are you nervous about?
I don't want to die.
You don't want to die? Yeah, you know what? Neither do I, actually. That's why I work, so I can get money, so I can get food, so I don't starve. But as far as it comes to having your neck manipulated, I know that it looks scary, guys, and Kyra, I know that it can be nerve-wracking. You've never had it done before, but it's a very safe thing to do, okay? I made a video about this a while back. The odds, like, first off, you're healthy, you're young. Mm-hmm. Really, only bad things happen if you're not in that position, okay? So, again, we already went through all the consent stuff off camera, guys, so that you're aware. But, Kyra, rest assured, I've done this, like, maybe 5 times before. You're fine.
Wait.
I've done this maybe 500,000 times would be a little bit more accurate. Okay, so I need 2 things from you in order to get this to go. The first is just to turn your head as far as you can to the left for me, please. Good. And then just relax that head into my hand. Now, when you relax your head, pretend that this is a pillow underneath you. This muscle is going to turn off, but I'm going to wait until that muscle turns off to get to the next step. Pretend it's a pillow. There we go. So you see how that shuts off now? The second thing that I need is for you to not know that I'm about to do it. Okay? Well done.
That was great. I think I'm alive.
I'm pretty sure, yeah. This light is the camera. It's not like the light at the end of the tunnel. Okay, you're fine. Okay. Now, how was that? That didn't hurt, did it?
Awesome.
No, you're awesome? Okay, good. See, very, very relieving effect. We got people in the lobby now, but I don't think we can hear them. So I'm going to go ahead and pull this over, and we're going to do the other side now. That was very good. You did a very good job of relaxing. Mm-hmm. Again, Kyra was just telling us how feeling through this neck definitely shoots that pain, that referral up into the temporalis region. That's the name of the muscle right here. So let's just keep working through it. If it becomes unbearable, you just let me know and we'll back off. Yeah, that's tender right there, right? Okay. So why don't we actually just get into it to spare this pain? I think I should once again drop the head into my hand, pretend that this is a pillow. Nice. Done.
That's awesome.
You sure you haven't done this? Well, I guess the one time, but right before that. But you haven't done this before because you're actually quite calm as compared to people who've never had that done before.
Yeah.
Well done. You
should be proud. Panicking is not gonna do anything.
I mean, you're welcome to, but it's still gonna happen, right? Like, I mean, no. So obviously, making sure that a patient is informed, is calm, and is understanding of why procedures are happening is paramount, guys. Okay, if you're a patient and you're watching these and your chiro or any form of doctor or healthcare provider seems very pushy or seems like they don't take the time to walk you through why things are being done, highly recommend you seek someone else, because that in itself is a bit of a yellow flag. Again, I'm just going to stretch this out a bit more. Trigger point work. You look like you're ready for a nap.
I mean, the pain's pretty bad, so no.
Oh man, we're gonna help you out.
Okay.
We're gonna get into the soft tissue work now. Kyra seems to be enjoying her time here, which is good. I like when patients are enjoying their time, but also it's always nice when you're a practitioner and you have the patients who you enjoy being around. I actually just found out that Kyra like myself, we both get this a lot, or we don't get this at all, rather. We're both Ukrainian, okay, which isn't something that I ever hear, and definitely not something that she hears. So it was just an interesting fun fact. We got that in common. We're both Ukrainian.
Look at that.
Anyway, so sorry, Kyra, you were going to say?
I met this one Ukrainian.
Yeah.
Who came from Ukraine, actually,
okay.
like a couple years
ago. Like a fresh Ukrainian. Yeah.
And I told him I was Ukrainian, and he just looked at me and didn't say anything.
He probably just walked away, right? Oh my
like,
God.
Oh, right.
Yeah, that's okay.
I expected it.
That's pretty funny. Okay. Anyway, so Kyra, at this point in time of the video, first off, I'm going to be doing the scraping massage on you.
Okay.
Now, with this, it is normal to get some redness of the skin.
Okay.
It should clear up within 72 hours.
Okay.
I'm just going to do your full back.
Okay.
All right. I usually like to ask the patients some questions about themselves so they can fill us in about kind of their lives. So is there something... Oh, you're sensitive there, aren't you? Okay, damn. Yeah. So this is the side... To reiterate that she was commenting on feeling that pulling sensation. When I press down here, she feels like a pulling down into the glute region. Is that correct?
Yes.
So, one thing to note, and you guys obviously can't feel this because you're not holding the tool, but when I'm holding this tool, when I scrape this side, it feels like, okay, there isn't too much feedback that I can feel in my hand. That's the way these are designed, so I can feel that. When I scrape this side, look at that. Okay, first off, she's super sensitive. Second off, I'm getting a hell of a lot of feedback through this tool. Okay? That tells me that this is what we need. We need to clear up this fascial component. Okay, so Kyra, I'm going to ask that you try really, really hard to just chill. Okay, like just stay calm. All right? And we're going to try to work this area for you and hopefully help you feel a little bit better. Okay? All right. So here goes absolutely nothing.
I'll do my best.
Well, you're doing great so far. How about I distract you by telling us to share a little bit about yourself? You mentioned you were like a big athlete. You played like college basketball and whatnot.
I did.
Read in between this. There we go. Okay, good.
So yeah, I played college basketball. I played basketball for about 10 years.
Okay.
Only played at Mohawk for 1 year.
Okay.
But that was pretty fun.
Mm-hmm. Why only the 1 year, if I can ask?
Because I finished my program, and
fair.
then I'm
okay,
like, I don't really want to pay
then
for
you're
school.
done.
Yeah.
Okay. That's fair.
But yeah, I did that, and then after I finished my program, I couldn't sit still, so I decided to do a bodybuilding show.
Wow.
Yeah.
Okay. Do you have any pictures from that?
I do.
Okay, let's just share some, and then I'll make sure to throw them up here so that people can like see, because that's a pretty big achievement.
That was actually a year ago today.
Mark the calendar. There you go. Congratulations. Happy anniversary.
Thanks. I was starving.
How was it? Yeah, no, they suck, right? They're terrible. I myself have not done a bodybuilding competition. I have lived with people who have, and I've kind of been around them my whole life, but for me, I just like food too much. But like the level of hangry that you get, and then like towards the week leading up, they take away your banana. You're not allowed to have your banana anymore. And that's when the psychosis starts to set in, because it is not a good time. Like you look absolutely deezed, but you can't even eat bananas anymore. You just want to cry.
Yeah,
right?
it was. Pretty
Did you enjoy your banana when you were cutting? Did you have a banana or no?
I don't think I had a banana.
Oh my God, you do it way harder. Yeah.
6 months, no banana.
Oh, that's so sad. I was
eating actually. So peak week, which is like the week leading up to your show.
Yeah. Mm-hmm.
You basically have to do this weird, I don't know, manipulation of the body. So I'm sure you know all about this, but basically I did.
Always down to learn more and hear other people's experiences.
Right?
So.
I think leading up to it, I was drinking 5 liters of water a day.
Yeah.
Like,
do you have to dehydrate out?
Yeah. So I was drinking the water at first, and then that was like for 3 days straight. And then on day 4 of peak week, I started taking coffee.
Okay.
And then 5 and 6 is when I stopped drinking water and continued to drink coffee.
Jeez.
So I was basically
literally dehydrated.
Yeah.
Okay. See, guys, that's not fun. Okay, like that's not a good time.
Yeah,
right?
that was pretty bad. But I looked shredded.
Probably.
Yeah. So
send those pictures. You know.
Yeah. Came in 3rd place.
Congratulations.
The girl who I competed against, she was probably on drugs.
She was probably on drugs?
Yeah.
Yeah, okay, well,
so she
we don't talk about it. We don't like her. She hasn't been on this channel, and she's not going to be. So, yeah. Unless you know her, in which case give her my number, because I'll take people. That's fine. Yeah, I'll take her. But we don't like her.
Yeah.
Otherwise, yeah, not a chance.
She did awesome, but like that was me. I decided to compete in the open show.
Okay.
So there was
that's kind of, you can do whatever you want, really. Yeah. Mm-hmm.
So there was an open and a natural. Natural, they drug test you. Open, they don't. Mm-hmm. So, yeah, she did pretty good. I did pretty good.
So what kind of drugs were you on?
Good question.
caffeine, technically.
Yeah, basically.
Yeah, I'm kidding. You don't need to share that.
Boiled.
If you don't want to. We're going to say boiled eggs.
Boiled eggs, boiled chicken.
Oh, boiled chicken! Oh my god, you are Ukrainian. Okay. You're way more Ukrainian than Jamaican. Like, that's for sure. Jeez.
It was actually disgusting.
Oh, I hate boiled chicken. It's so slimy. It's just like, ugh.
No seasoning.
No, why would you, right? That's I don't think there are many calories in chili flakes. Are there? Like, jeez.
It was the salt, though. Like, it was the...
Yeah, okay, it makes it bloat.
Yeah,
Okay,
yeah, that's it. This is pretty bad.
Is it?
Yeah. I'm not gonna lie.
So, especially in that upper trap, like, we got that we got that redness forming right here.
Yeah.
That's normal, once again, with this intervention, because we're trying to work that fascia. I'm probably going to get you to sit up eventually so I can work this trap a little bit better, because this angle is a little bit wonky.
Yeah.
Especially on my low back. Not that I matter when I do this, but, you know, getting old now.
Do you ever get, like, some serious pain when you're...
Oh, all the time. Yeah, it's nothing sadder than a chiropractor with back pain. But let me tell you all about it.
But yeah, that was a pretty good experience.
Well, I'm glad.
Won't do it again. But
what?
I was so
You didn't enjoy yourself?
I was hungry.
Oh, probably, yeah. I'm hungry right now. I'm trying to lose 15 pounds, and I'm like, yo, I could eat just about anything.
Yeah, seriously. Yeah, it's pretty intense, though. But it's rewarding.
You know? Oh, no, it's very, very rewarding.
Yeah.
Without fail, like, I mean, the people who I know who've done it before, some of whom I count amongst my very close friends, like, they say it's a great experience that they never want again. Like, that's literally. It was so great. Never again. Like, it was just, okay, sure, I guess. Oh, that makes perfect sense, yeah. Mm-hmm.
Now that I hear that from, like, another
person who's seen it, yes, like, yeah.
Because I say that all the time.
So good, never again.
People are like, why not?
Why do you think? My banana. Like, that's my excuse, at least. Not that I would ever do one to begin with. I'm not that crazy.
Yeah, and then I ate whatever I wanted that night.
Almost
had a heart attack.
Probably, yeah. It's nothing funnier than crushing a dozen donuts and spending an hour in the bathroom. Your system's like, wait, what's the sugar? I forget.
Yeah, it was pretty bad. Mm-hmm. But I got a medal.
Oh, we like medals.
Yeah. It's in the basement.
Do you wear it all the time?
No.
Oh, what? What's the point?
Know, right? Literally. I think I wore it for like a week.
Probably, yeah. Showered with it, slept with it, you know. Took client calls with it. Like, hey, is that a medal for real estate? No, it's for bodybuilding, bro. So one other thing that I want to point out here is that I was actually scraping down here, which was the spot where she was super sensitive, literally just like 8 minutes ago, because that's how long this video has been rolling for, and she's not reacting at all anymore, okay? So it's calmed down, which I really, really like to see. Well done. That, or do you just have the mental fortitude of like a monk? Like, what's...
Could be either or.
Both. Why not?
Yeah,
okay.
why not?
another take of doing the instrument soft tissue therapy for Kyra here. It can be kind of difficult to get the upper traps from a prone or laying forward position because they come up into this region and they actually snake into the front or the anterior aspect of the clavicle here, the collarbone. So to get at that, if she's face down, I'm like craning my back. It's actually a lot easier to get it sitting up. So are we able to actually pull this down to here? Is this stretchy or no?
I can.
Not really. Okay, that's. I don't want you to. Well, actually, hold up. We almost have it. Yeah. Okay, that's good. Perfect. Okay, we're good like that. Awesome. Okay. Yeah, we were almost there, and we were there. So here, same deal. We're gonna just use a little bit of gel there. Might have spilled a bit. That's okay. And just like that. Okay. So what's real estate like these days, eh?
The market.
It's pretty trash in Ontario.
Pretty brutal. Yeah. Like, there's a lot of houses on the market for sale, but nobody wants to buy them.
Well, why don't you buy them all? Oh, wait,
I also
because
can't
they're all
afford
ridiculous. Yeah, that's fine.
Yep, that's it. So, yeah, once interest rates drop, people are going to get back into the market, buy these. It's just going to be a much better time come spring.
I really hope so, because I've been waiting on that much better time for the past 5 years. So I'm starting to lose faith. I don't want to.
Don't listen to me.
I know that government-wise, I'm going to vote for whichever party says affordable housing more. And that's because I don't learn. Okay, that's because I have been disappointed over and over and over again because affordable housing is still nowhere to be seen.
Nope.
And I still fall for it. Every election I fall for it.
And it's worse.
Yeah, it's terrible. It's worse. Yeah, it's worse. So I don't know who to believe, so I'm just going to put down a tally. If if liberals say it more, I vote for them. If conservatives say it more, I vote for them. If NDP says it more, I vote for them.
Yeah.
So if Green says it more, which they won't, I vote for them.
Which they won't.
Yeah. Those are the ones I'm going to vote for.
Yeah. Yeah, it's a little messy right now. That's okay. But...
Well, hats off to you for working in that field because I know that I don't have the patience for it.
Yeah, I'm losing it a little bit.
Yeah, I might go full into the personal training industry. Like she's ready to kind of. So I'm gonna kind of wrap around, give you almost like a hug here. But,
nice.
Yeah. Now, is this too tender at any point in time? No. You do okay? You're hanging in there. Good. Okay. And then, as far as the personal training goes, when did you start doing that?
6 months ago.
Okay, so that's a newer thing.
Yeah.
Right? Okay.
Yeah, I went to school for, it's called the Fitness and Health Promotions Program.
I think I've actually heard of that.
Yeah.
That's where we find people here at Primal to work. Right?
Yeah. So it was like 2 years, did that.
Oh, sorry.
So you're okay.
Mm-hmm.
Didn't go into personal training right away.
Until you did.
Until I did. Mm-hmm. So.
But yeah, I take it you probably enjoy doing that, though.
Oh,
I mean, you should just tilt your head like that.
I really enjoy
What is it about that you enjoy, if I can ask?
It's really rewarding.
I hear that a lot. I have a lot of personal trainers on this channel. They all say it's a rewarding job. So that's, if you think, and if you're watching this, you want to be a personal trainer because you're feeling unfulfilled, might be a good fit for you.
Oh, for sure. Mm-hmm. It's cool, not the results that they'll come usually no matter what if they put in the work. But the most rewarding part I would say is when they're, for example, I have knee pain. Okay, adjust this. Oh, now I know how to activate my glutes.
Exactly.
I'm like, that's cool. I taught you that.
I experienced the exact same thing in my position.
Oh, really?
So because a lot of what I do is rehab too. You're not really a rehab patient per se. You're not post-op or anything, so I don't have to worry about that. Mm-hmm. But I get what you're saying.
Yeah.
I fully get that.
Yeah.
I think you should look up and to the right for me, please.
Thank you.
Say hi to the camera. There you go. And now you can slowly look down to the left for me, okay? Good. Up to right. Slowly down to left. Oof. Just think of all the different ways you want to punch me right now.
Almost didn't make it.
Up to right. Down to left. This is that MRT that I usually do. Guys, I just prefer doing it from this angle if it's already set up. Up to right. Down to left.
Yeah, I don't know if I can make it any
You got it. One more. Up to right.
Okay.
Down to left. Good. I want you to face forward for me now, please. I want you to tilt your right ear to your right shoulder. Now slowly tilt left ear to left shoulder. Go ahead. Good. Right to right. Now, guys, something popped there.
Yeah.
Guys, I have been playing, you keep doing that motion, okay? I have been playing, go ahead.
Oh.
Yeah, keep doing that motion. Okay. I've been playing Game Boy since before I could read. Okay, like you remember playing Wave Racer and Pokemon before I even knew what was going on in those games. And I remember my mom would worry, it's like, oh, he's wasting his time, he's not like learning anything applicable with it. My thumbs are so strong. Okay, like I was preparing for this job before I knew how to read. You see, that's all thumb contact right there, and we're just fine.
There we go.
We'll do 2 more. Go ahead. And last one's going to be right here. Good stuff. Yeah, so if you are a long-term chronic gamer, something with your hand strength, that's probably going to be you. Or take up rock climbing for a hobby. Something active. Keep healthy. I need you to shrug this shoulder up for me. Slowly lower it down. Oh my goodness. Up. Slowly lower it down. And up. Slowly lower it down. Hey, guess what? You survived.
That was pretty bad.
Kyra, how did you find... We did quite a bit today, all right? We were doing... we worked on that psoas muscle. We adjusted everything for the first time. We beat the crap out of you with the tools. How did you find all of that?
It was really good.
It was good?
Yeah,
okay.
It was really good.
I am very happy because so far we have a straight streak of people saying that it was good on camera. I'm still waiting for when somebody eventually goes, this was shit, and I'm sorry that I came in. Anyways, okay, so you enjoyed it. If I can ask, what is it, how did you find it good, or why did you find it good? Was there a particular element, or?
Yeah, I feel like I've never tried Chiro.
Yeah.
Because it freaks me out.
Fair, that's very common.
And you really just, like, reassured me, and you said it was all good. So, yeah.
Well, thank you. I'm glad you found it reassuring.
And you didn't break my neck.
I didn't break the neck. Did not break the neck. It's here, video proof. Something that's very important when somebody's coming to you, especially from a health-related perspective, and you as the professional they're seeking your guidance, is this concept of mirroring. Okay, mirroring is the idea of matching their energy in a way, because that can help somebody feel more comfortable, right? Kyra and I, we've been joking a lot, we've been laughing a lot, and we found out that we're both Ukrainian, which is awesome, right? But with a patient who's maybe a little bit more reserved, a little bit more shy, you need to bring back the energy a bit, be a little bit more calm that way. But I feel like the combination of matching the energy and also walking through the risks and procedures, giving that informed consent, which is always done off camera. It's not necessarily done on camera, but it's always done off camera. Very important process. Okay, it helps everybody feel more comfortable. I hope it made you feel more comfortable. Exactly. Good. So happy to hear that.
Yeah.
Now, did you have any other questions or comments, concerns? Was there anything else you wanted to talk about for today?
Yeah.
What's up?
So in regards to any of the issues you pinpointed out.
Yeah.
One, what exactly did you find? Two, would you recommend chiro or massage therapy?
Yeah, so let's kind of summarize what I think is going on here. So first off, definitely a psoas issue. Okay, that psoas issue, it's more prominent on that left side. Okay, and that is it's more tender when we poke in through here. Okay, and it's also going to end up causing that like kind of nagging deeper back pain on certain movements. Okay. Now, if we can picture this, the psoas exists connecting from the groin-ish area, so around here, up into the low back. Okay, it's our sitting muscle. It flexes our hips forward. So if we're like this constantly, which you are because you're driving as a realtor, that can eventually spasm up and not feel great. All right. So if this muscle is contracted and pulling everything down this way on the left side, that can give you the appearance of having an elevated right trap. Okay, because again, picture here, if this is compressed, what ends up happening, you get that elevation on the right side. So I think it all really does come down to that psoas. The answer is, how can we release it? Okay, now one option is, of course, yes, seeing somebody who's familiar with the anatomy and drilling down in there with my hands like we did. That's the massage therapy approach, which is totally valid, okay? Another option is to actually do some acupuncture work, okay, where we'd be coming at it from the back and trying to get deep into that muscle, because again, the psoas is a deeper back muscle. And then the third is the physical therapy component.
Okay, what is acupuncture? Sorry to interrupt.
What is acupuncture?
Yeah.
It's you know, have you ever heard of like the traditional Chinese medicine where like people will like get poked with needles?
Yeah.
That's what acupuncture is.
Okay.
Okay, yeah. So I do dry needling, which is like a derivative of it. We didn't do it today because frankly we're out of time. I want to go eat lunch and you probably have to go show a house or something. But yeah, so that's one method to handle it as well. And then also there's the physical therapy method, which I guess I'll explain to you off camera here, but it's essentially stretching that psoas out whenever possible. Okay, so what I like to recommend is a couch stretch. Essentially, you'll put one leg behind you on an elevated surface. You'll push your hips forward and lean backward. That's a great way to get a deep stretch in through that front hip. And if you lean far enough back, in through the back as well. If we can knock that out, let's say, maybe for 30 seconds, 5 reps, morning and night consistently, I think that'd be a great way to open up that psoas, correct both your issues there. And again, I'll walk you through that off camera as well. It's very simple though, and I think you'll be able to figure it out just by seeing me do that once. Great question. Yeah. Always make sure you summarize what you've done with the patient, guys. Okay, that's important. Any other questions, grade or otherwise?
That was about it.
That's it? Perfect. All right, so once again, I'm confident we can get this under control. I'm confident it's the psoas because multiple practitioners are saying it's like that. And thanks for coming in. Yeah, you've been great. It's very nice getting to know you better. Yeah. Have a great rest of your day, okay?
Yes, you as well. Don't forget to like, comment, share, and subscribe.
Thank you so much, Kyra.